Hello, welcome to today's presentation, Suicide Prevention, Awareness, Support, and Hope, presented by Dr. Seema Sehgal, psychiatrist with Washington Health Medical Group. Dr. Sehgal is board certified with the American Board of Psychiatry and Neurology. She earned her medical degree at the Armed Forces Medical College in Pune, India, before coming to the United States for her internship in psychiatric residency at the California Pacific Medical Center in San Francisco. Dr. Sehgal served the Fremont community for 14 years as a staff psychiatrist for the Alameda County Behavioral Services Department and the Alameda County Crisis Response Program. This experience in treating patients from widely diverse cultural and ethnic backgrounds provides Dr. Sehgal with a unique perspective and sensitivity for the influence of culture on the varied presentations of psychiatric illness in our community. Please welcome Dr. Sehgal.
Thank you, Kayla, for that introduction, and hello everyone, and thank you for your time and attention today. Today I will address a topic that touches every community, every background, and every life. Suicide prevention can be a difficult topic to discuss because behind every statistic is a person, a life cut short, a story interrupted, and a family changed forever. Today I hope to not only raise awareness, but also give you the tools and build your understanding and compassion to help those in crisis. Before we begin, I want to acknowledge that this is a very sensitive and deeply personal topic for many. It can stir up powerful emotions as you listen with your own experiences, your own losses, or simply a heart full of love and care for others. Please know it is okay to pause this talk at any point and to take a break or reach out for support if you need it. Today, what I hope to cover is understanding the warning signs of suicide, how they differ from the risk factors for suicide, how to talk about suicide, and the basic intervention skills to use when you are with someone who is at risk for suicide. I have included some helpful resources in the end that you can peruse, and I'm sure you will find more helpful information there as well. When we look at the scope of suicide, I always like to look at it from a world perspective and narrow it down to our national statistics and then to our state statistics. So in the world, approximately 1 million people die by suicide every year. In this country alone, almost 50,000 Americans lose their life to suicide. And that is about one in every 11 minutes we lose a person to suicide, which makes suicide the 11th leading cause of death in the United States. This can sometimes be a slightly misleading number because when we look at the first 3 top causes of death in the US, it is heart disease, cancer, followed by accidental death. Under that accidental death, it includes car crashes, it includes falls, it includes accidental overdoses. A lot of these, because of the stigma associated with suicide, often result in underreporting. And so even though in California we have roughly about 4,000 suicide deaths, these numbers can often be very misleading. I have this slide to show that for every person who loses their life to suicide, there are 25 other lives that have attempted suicide unsuccessfully. And so the magnitude of the problem is often larger than what we initially estimated to be. At the very beginning, I would like to address some common myths that surround suicide. The first of which is, if I talk openly about suicide, will I cause it? And the answer is absolutely not. In fact, it is one of the most powerful interventional tools you can bring to someone who is struggling. Number 2, anyone can learn to help someone who is struggling with thoughts of suicide. And that is true, and I'm hoping that by the end of this talk today, a lot of you will feel a little more empowered, have the language, the words to help someone that may be struggling. Number 3, if someone decides to take their own life, there is nothing we can do to stop them. And once again, this is false. Oftentimes, we are not sure about what to do or how to help the person that we know is struggling. Again, I'm hoping this talk will help with that as well. Number 4, if someone talks about suicide, they don't need to be taken seriously. In fact, that is false, and it is a serious place to address the issue of warning signs, because if someone is talking about suicide, they are in crisis and need to be taken very seriously. Number 5, there are signs we can look for as indicators that someone is considering suicide. And we will talk more about that, because the more empowered you are about learning about it, the sooner you can identify and intervene to help someone. Now, risk factors and warning signs are two separate indicators, and these are important to differentiate because risk factors are something that we can mitigate to reduce the risk of somebody becoming suicidal. The example I often like to give is thinking of it in terms of heart disease. The risk factors for heart disease can be obesity, hypertension, which is high blood pressure, or smoking, or a family history. And if we try and control those risk factors, we can reduce the risk of the person having a heart attack. A warning sign of a heart attack, on the other hand, is when the crisis has already begun and the person is having a heart attack, which is indicated by chest pain or shortness of breath, and you need emergency services at that time. So using that example, the risk factors for suicide are many, and these are important to know, because if we can come in, identify patients who are at higher risk and treat these conditions early, we significantly reduce the risk of suicidal behavior. So among risk factors, there are some mental health conditions like depression, anxiety, bipolar disorder, a prior history of suicide attempts that puts these patients at higher risk. Aggressive treatment of these conditions becomes important. Substance abuse or use is often associated with suicidal behavior for two reasons. One, it definitely decreases their inhibitions and it makes them more impulsive. So this becomes something that we look for even when a crisis is unfolding. Sometimes people will, use alcohol or drugs to get that courage to go through with the act of attempting to take their life. Life events which mainly are around loss. So loss of a partner, a family member, loss of a marriage, a job, all of these, including trauma, and the trauma could come from war, it could come from abuse, both witnessed or experienced, that can increase the risk of suicidal behavior. There are sometimes factors embedded in the patient's history that can act as clues. If there is a family history of suicide, or there is a history in the person themselves of non-lethal self-injury. And what we mean by this is that the patient is sort of, attempting these small injurious self-inflicted injuries, for example, cutting on themselves, non-lethal overdoses, or, we see their history of going online to see what are some lethal combinations of medications that they could use. And these are not at all for attention behaviors at all. These often present as gateway behavior and lead to an almost 3 times increased risk of the suicide. Other risk factors are access to means, and this includes access to firearms, other lethal methods. For example, if there are family members who are on medications like opioids or other medications that can be lethal in an overdose, become important to pay attention to if you have someone who is experiencing suicidal thoughts. There are many social factors, and among them, a disconnection, a sense of isolation, a feeling of lack of support, or if there is stigma associated with talking about mental health issues, or you are in a family that does not have an open communication around mental health issues and has limited access or no access to health or mental health care. if there is again history of abuse, there is modeling of behavior at home that does not encourage seeking or reaching out for help, can also increase the risk. If there are children, we always watch for bullying, we look for racism, we look for harassment, there are relationship problems, break up with a girlfriend or a boyfriend, and no one to put it in context or help you through that can often also lead to suicidal behavior. Sometimes when people are having medical issues which they feel there is no end to, or there is increased suffering, there is chronic pain, it can often, the suicidal thoughts can often appear as an escape from that, and this too has to be taken into account. Now we talk about the warning signs, and these are, indicators that a crisis has begun, that the person is imminently feeling suicidal and seriously considering ending their life. And the warning signs can manifest either in their talk, their behavior, or in mood symptoms. So when we listen to a person who is suicidal, we will hear things like, I wish I were dead, I feel like a burden on everybody, the world would be better off without me in it. There'll be, feelings of being trapped, that there is no escape, there is no out, that this suffering is going to go on forever and the only escape is through ending your life. There is a sense of hopelessness and helplessness. There is the experiencing of unbearable psychological pain. It does not only have to be physical, but unbearable pain of the emotions that you're going through can often also be powerful instigators. And if you hear someone say that there is really no reason for them to live and nobody would miss them were they not to be in this world, or the world would be better off without them, these are all indicators that a crisis is unfolding. Among the behavioral warning signs, please watch for any change in behavior from how you know your loved one to normally be. And these could be increase in the use of drugs or alcohol, as we had spoken earlier. These often will make people more impulsive. They tend to decrease inhibitions. They tend to give you that sort of false sense of bravado and courage to go through the act. The access to lethal means, that you find themselves, looking online to purchase a gun. They are trying to get, illegal drugs off the streets in an attempt to maybe overdose. So all of these need to be watched for. If you see somebody's behavior changing, as in children, we often see they withdraw from activities they normally enjoy. They're not showing up at school, they're not participating in their sports activities. You're getting sort of warning signs from different people who interact with your loved one. Those are to be watched for. Isolating similarly from family, they're in their room, they're online for extended periods of time. Another thing we see commonly is people start to call and say goodbye to people they love. They start thanking them for being such, important people in their lives, sending farewell messages on social media. And for older people, it's about making a will, giving away possessions, or changing their wills. And so these are again things to watch for. Increase in reckless or risk-taking behavior, because they've thrown caution to the wind. They don't care whether they live or die. So suddenly you'll have them driving erratically, driving their cars unsafely, or using excessive, again, drugs or alcohol with no ability to really now look at their own behavior in the context of living. It's all about having given up hope. The mood changes we often see include a sad or emotional withdrawal. So depression again is one of the mental health conditions very highly associated with suicidal thoughts. And so to look for that sad mood, that loss of interest, that sense of worthlessness, guilt, all of these indicate the intensity of depression. On the other hand, it could also manifest as rage or anxiety or irritability or a very activated state of mood. Along with that, there is this sort of tinging of humiliation, shame, guilt. There is despair. and or there's a sudden sense of peacefulness. And that is a really significant warning sign, because that's the time when the person has made up their mind that they're going to kill themselves, and they're suddenly at peace because they feel that their problems are finally going to come to an end. Now, when we talk about protective factors, I like to talk about protective factors as factors that are colored by not just our interpersonal belief systems, but also society at large. Because we have to build communities that support good mental health, that allow conversations around mental health to happen, that have robust mental health services, which we know clearly protect against suicidal behavior. So access and support to mental health services, the connectedness, the importance of good positive parenting connected to family, having that sense of confidence, building that in our children, not just to the family, but to community, to spiritual resources, all become sort of buffers between, what life is throwing at the person and their ability to sort of bounce back with resilience and deal with those stresses. So caring relationships that are non-judgmental, that are not just, assuming, that are using mental health judgmental titles and labels are important to be aware of. Giving our children good problem-solving skills, good conflict resolution skills, and having them understand that when problems happen to them, they are not the problem, they are good people solving life's problems. And so that sort of parenting becomes very important. Teaching them through modeling non-violent ways to handle disputes is another important protective factor. And of course, the cultural and religious beliefs that support instincts for self-preservations, that teach you that taking your life is not the answer, but really growing within that sort of crucible of tests that you're being put through becomes important. Now, we move on to what do you do if someone tells you they're feeling suicidal? Most people are not used to being put in that position. And so their own anxiety sometimes gets in the way, and we tend to either disregard the importance of what is being shared with us by either taking it lightly or just disregarding it altogether. So the first piece of advice is get used to just saying the words, "Are you feeling suicidal?" And sometimes just asking that directly, not tiptoeing around it, shows you care. And as we've already established, it does not increase their risk. In fact, it gives a certain sense of relief to the person who is talking to you to hear that you are there, you see them, that you matter to them, and you're genuinely concerned about them. The next point is listen without judgment. Because we tend to, unfortunately be colored by so many of our own unconscious biases, our own anxieties. And to stay calm in that moment, to stay present is really important. We don't want to jump in and try to fix the problem as, makes us feel like we are doing something. I always say to bear witness to somebody's suffering is an act in itself. And it is a real great act of compassion. And sometimes just practicing being with someone is all that moment needs. Getting help as soon as possible if you feel that the threat is imminent. Do not leave them alone, especially if you feel the person is really unstable. Stay with them. Getting them connected to either professional help or through a crisis resource, calling 911 or 988 is really important. And as you do all of this, staying with them, physically with them, staying connected in the moment, and subsequently circling back to check in, see how they're doing, following up with them, again indicating that you care about them and that you take this very, very seriously. Now, equally important is to know what not to do. And these are things we tend to do inadvertently. We don't realize to a person who is feeling that low and suicidal, out of control of managing their own feelings, what it feels like to hear someone say, I know how you feel. I don't think anybody can truly feel how someone at that moment, how low or how much in despair they are. So to say something like, no one ever said life was fair, or you need to stop feeling sorry for yourself, really doesn't help that person build that sense of confidence in talking anymore with you. Again, acting shocked or outraged, having any sort of an extreme emotion is something that we want to be mindful of not portraying. And again, sometimes, if there is a friend who is the support, will dare the suicidal person. I don't believe you, go ahead. I don't believe that you're going to actually do this. So daring a suicidal person to attempt suicide is never a good idea. And similarly, not to argue or lecture or sort of contest their feelings is equally important not to do. So if you're a child, you have a friend who's confiding in you, do not promise to keep this a secret. Help them connect and stay connected with them. So talking to a responsible adult is the thing to do. Now, building a supportive culture is often one of the best ways to prevent suicide. And, as I'd spoken earlier, this involves parents, schools, society at large, our communities, national policies even. And all of them directed to basically reducing stigma around conversations around mental health. And how do we do that? I always say that you have to be the change you want to see. And so to be able to talk about your own challenges regarding mental health is often one way of normalizing these conversations. And to be direct and not tiptoe around these issues is another simple way to have a conversation as you would about any physical health condition. Encouraging your children to get engaged with peer support and training. And I tell parents who are often struggling with children who have suicidal thoughts or have adult family members who are struggling with suicidal intent to take what we call a mental health first aid course. And these are offered by various organizations. They are online, they can be taken in person. And these are, traditionally about 6-8 week online courses that really emphasize teaching you how to become fluent in the language of talking about mental health issues. It gives you the words, it makes you more comfortable, it teaches you about the warning signs, the resources out there, and all of them have in common this action plan, which has an acronym called ALGE, where the A stands for approach or assess. So when you know someone is in crisis or is, having suicidal thoughts, you sort of, again, non-judgmentally assess their risk. You look to see, do they have access to lethal means in the moment? You listen non-judgmentally. You give support and you get support for them. The 2 E's stand for encouraging them to seek professional help, as well as encouraging them to build their own internal resources, their own ways, their own internal strategies to come to this moment of crisis with some resource that may be lacking in the moment. In school, I often talk, to parents, I'll often talk to students about this is not a secret you want to carry. This is a responsibility that you have to take to a responsible adult. So to acknowledge the crisis your friend may be in or your child may be in, showing the care, and the care often is about getting them the help by sharing that information with someone else, which is the telling. So the ACT standing for acknowledging the crisis, showing that you care, but then telling someone responsible who can give them the help that they really need. Now, a lot of suicidal patients, when I see them, in my practice, I will often sit with them and make what we call a safety plan. This is it's a wonderful therapeutic intervention that encourages the patient who is depressed or anxious or at high risk for having suicidal thoughts to actually sit and look at what are really their coping strategies, right? What is it that they are lacking that they might need if they are in a crisis? What are their sources of support? And what do you do if you're alone and you're in crisis? What is your plan? And so this plan is made, in the presence of a professional person. It could be a therapist, it could be a counselor at school, it could be even your primary care physician. And I have a template of a plan that I'll go over. And it really highlights that it is something that if you have a family member who is suicidal, to have this posted in a very prominent place at home. Often the kitchen is one such place where everybody in the family is on board with this plan, so that if there is anyone at home and there is a crisis unfolding, you know exactly what to do. So a safety plan example could be, and this is filled out by the person who is at risk. What are your warning signs? Because again, they can be different for different people. Different triggers affect people in different ways. And so to recognize your own warning signs is important. Putting in paper down, is what are your coping strategies? And these are just, 3 columns. But if you feel you have to and you cannot come up with a third, it's a place that you can work with a therapist or your physician to work on these specifically. The people, the social settings that can provide a distraction in a moment of crisis. And this could be something like sitting in the mall where there are a lot of people, you feel secure, you feel safe around people, or sitting on a park bench maybe. And, just letting that moment pass is often helpful. Step 4 is, who are the people you can ask for help? And this is very specific. It's almost like the lifelines. At that moment, who can I ask for help? The name of the person, their phone number, and this, usually should be more than one. So at least 2 or 3 people that if one is not available, you can quickly call another person. Step 5 is the professionals or the agencies that you can ask for help. And here again, very specific with the name of the clinician, their phone number, your primary care doctor, the emergency room contact, any of the local urgent care services, having the suicide prevention lifeline 988, the text line easily available for anyone to access and use. Step 6 is making the environment safe. And this is keeping, if you have firearms at home, keeping them locked always. Not having, the code to the safe available to everybody in the house, making sure all your medications are locked and in a safe place as well. Step 7 often is, I think, one of the most important steps in this whole process of making a safety plan. And that question is, what is the one thing that is most important to that person and worth living for? And I'm often surprised with the answers that people will put down on this. Someone will say, it's my cat. I worry about what will happen to my cat, or my fish, or my bird. And so, if as the person's life unfolds and if the crisis comes back, and I hear that they are giving away their pet or giving away their fish or bird, it suddenly becomes an important piece of behavioral warning sign that I immediately can come in and do something about. And when the patient is doing this particular step, often they will rethink their entire idea that, is killing myself really the most fair thing to do? Or how would that person or that thing that they are solely responsible for, or who depends on them in some cases, what would their life be like? So it gives them a perspective which is different from just the one that they have. Final thoughts I have is really the primary goal here to take away is that everyone has a role in prevention of suicide. It is not just the person in the immediate circle of care. It is, as I mentioned, it can be a teacher, it can be someone, there are times I remember I've been at a grocery store ordering a cake, and the person taking my order has appeared distressed or preoccupied, and I just struck up a conversation, at the end of which the person has once turned around to me and said, I don't know what you do for a living, but you should really consider becoming a therapist. And so it was a moment where I just happened to be there, gave a listening ear, listened with compassion, and it made all the difference in that person's life. And so early intervention, recognition, and leading with compassion, recognizing that there is a common humanity that binds all of us, and that people who are struggling, that could be you or me, it's them today. And so training ourselves to talk about it compassionately, becoming fearless about recognizing our need to talk about something distressing, recognizing it in somebody else, and taking action if you see someone else struggling is really the way to prevent suicide. And if you can convey a simple message to someone who is really struggling, let it be, you are not alone, you matter. So one of the ways that you can propagate this is sharing this video with your loved ones, with your family and friends, as a first step towards normalizing conversations around suicide. And sometimes it becomes a springboard. Someone else gets it, and it becomes sort of, a simple way to begin a conversation which otherwise would seem really, really difficult. So as I promised, I have 2 slides of resources here. There are many more, but these are ones that if you go to, they give you a lot of concrete steps, and there are some trainings, there are other resources embedded in them, there are videos you can watch, there are ways to learn about just familiarizing yourself about mental health, words, constructs, ideas, and really becoming aware of your own judgments, our own assumptions, the way we are so quick to judge someone who is struggling, and teaching ourselves that little bit of compassion, I think, goes a long way. So I hope you have time to review these and find these helpful as well. And with that, thank you so much for your attention today.
Thank you. We have a few questions. The first question is, what treatment options and therapies are available for people with suicidal thoughts?
That's a great question, because I think by the end of the talk, as most of you are now familiar, that there are many mental health conditions that increase the risk of someone becoming suicidal or having suicidal thoughts. And so treating each of those individually is really important. So if I have a patient who's young, has minimal social support, is depressed, that is someone that I'm going to work with very closely to make sure that they are getting the help that they need to overcome whatever it is in the moment that they are struggling with. And there are certain therapies, because people who are or become suicidal are people who have some difficulty modulating their emotions. So emotional regulation is a really key part of mental health. We all are put through the paces in life, and we go through situations in life where we can feel extremes of emotions. We can feel despair, we can feel anger, we can feel frustrated. But the ability to regulate our emotions, to be a container greater than our emotion, is a skill that can be taught, and these are usually through therapies like DBT, which is dialectical behavioral therapy, which help especially young adults really deal with their emotional storms to where they become less impulsive and more thoughtful. Their reaction times increase, they become sort of more able to think through the problems, their problem solving skills improve. So these are some of the therapies that go a long way.
Thank you. The second question is, are certain age groups at higher risk of suicide? For example, school-age children or older adults?
I think in that question is the answer, because both of these demographics actually have an increased risk, and unfortunately in our country and around the world, we are seeing that there has been a tremendous uptick in younger children becoming, suicidal, ages that we had never thought would ever think about suicide. And these are, the young adolescent. And we have the other extreme, which is, the end of life becomes a risk factor also for suicide. And just knowing again that these are risk factors, educating the pediatricians and the geriatricians about the warning signs for these in their routine follow-ups, that you're not just focused the one thing I always like to emphasize is we have to stop this artificial separation between mental health and physical health and look at it as holistic health. All of us matter. So our mind absolutely runs our body, and similarly, if my body is not doing well, my mental health is impacted. And so, pushing that message that both are equally important and anybody can check for either. If I'm a mental health provider primarily, but I always have my ear to the ground if I have a patient who's in chronic pain, who has life-threatening terminal illness. I cannot ignore that and focus primarily on the mental health. And so really in widening our lens and becoming more inclusive is another wonderful preventative factor.
Thank you. This concludes our program. Thank you, Dr. Sehgal, for this insightful presentation. And thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.